Hello, I'm Alexia Monroe. I've come here from Prescott, Arizona to share with you about Bowenwork.
Welcome to all of you who are showing up here to hear about this beautiful work called Bowenwork. Originally from Australia, now practiced in 30 countries plus all over the world. It is a different approach. It is body work, but it is not massage exactly. We do touch the body. We are doing something very specific though with Bowenwork. When we do this approach through Bowenwork, we are actually stimulating a whole brain response by going through the internal nervous system. A completely different intent with every single touch we do. And it's very precise so that it is gentle on purpose to not influence very much the external nerves that let the body think it's bumping into something in nature. So with Bowenwork, we are very interested in how to stimulate the brain to elicit what seems like a very natural response of put it back. Now, Tom Bowen is the man who developed this work 50, 60 years ago in Australia in the early 1950s. It's been practiced all these years in Australia, but only since basically the late 1980s started traveling outside of Australia. So it's not terribly well known yet, but everywhere it travels, it becomes known by its effectiveness. Every person who comes into contact with Bowenwork usually ends up saying, I've never encountered anything like this. My body had had pain in my neck for 20 years from that whiplash injury, from that car accident 20 years ago, and I've received every possible kind of body work. I have received this and that, and it's always still there. Temporary relief, but still there. And then we do these simple stretch, roll, release moves that we do, and we leave it alone for a week at a time, and the body will reinstate often the more relaxed, normal resting rate of that tissue, even after 20 years of dysfunction. That's what we're known for. This works on not only musculoskeletal issues, but even things that are not so obvious, such as plantar fasciitis. Most people have not had good success with that. Bowenwork has great success with it. Sciatica. We have a very good rate of success with that by helping untwist the soft tissue twists that the body can end up with. The first time you ever see that, it changes your world. We have an incredibly high rate of success with chronic migraines. And Tom Bowen's insight on that was that the tailbone is often responsive. The soft tissue at the sides of the tailbone can be locked up from an injury, perhaps when we fell off the bike when we were 8 years old. It is very common that the soft tissue is damaged at the sides of that tailbone. And now, 40 years later, there is kind of an adhered tissue at the sides of the tailbone. We do our stretch, roll, release move on that soft tissue and find that the tailbone can reinstate its normal position and the migraines go away. His insight about tailbone included that it has a lot to do with infertility and endometriosis and chronic constipation. So we are very well known for our work with all of those kinds of internal conditions. And I can tell you right now, I have a 75% success rate working with infertility. One of the most beautiful things that we have to offer the world is its effect on colic in babies. Tom Bowen's insight was that colic is often caused by the baby naturally twisting out of the birth canal, and in the process of the twist as they're coming out can clamp the diaphragm down on the vagus nerve. And we claim 100% success with colic in babies. Bowenwork is the most holistic therapy that I've ever encountered. And I've been in the field of bodywork for 25 years. It affects the brain, so therefore everything in the system. We work very effectively on high-level chronic pain, where someone has a constant high level all over pain everywhere in their body ever since, let's say, a surgery. And now these patients are usually just on high level of painkillers, and the doctors have nothing more they can give them. They don't know what to do about it. We have an incredibly high rate of success with this. I had one case of a British fireman, a fire captain. He has given me permission to tell his story, and he's even taped a recording of it for us to pass along to fire stations. He was at the bottom of a ladder when a fireman fell 2 stories during a fire straight onto his head and cracked his spine just like an accordion all the way down. He had been on disability for 11 years when I met him. When you ask him a pain scale of 1 to 10, he would say 20. He had been so addicted to painkillers most of his life since then. He had been dysfunctional completely. He had a wife and 2 twin daughters who were like 5 when I met him, and he just said, I've got to at least show up in my life, even if I am in so much pain, but I can't stand it because the painkillers aren't even working. So he took himself off of them. After the first session, he got up off the table and said, my pain has gone from a 20 to a 5. What in the world did you do? After 5 sessions, he describes his pain as 1/2 on a scale of 1 to 10. It has completely changed his life, brought him back to being functional and being able to hold a job. Now, Tom Bowen passed on in 1982, so I never got to meet him personally, but he developed this work over 30 years in Australia during his life. He basically developed it from some early influences of the very early osteopathic work. Not the way osteopathy is known to be practiced now, but in the very early stages of it, when they were working very gently with soft tissue on either sides of the spine. He was influenced by that. And so some of our approach is with that gentle stimulation of the central nervous system through the nerves at the sides of the spine. He developed it through a lot of intuition and a lot of trial and error. He really was a good scientist in the sense that he would just get a feeling for how a body was twisted or locked up. He'd go do this stretch, roll, release move we do that allows the body to start flowing its natural life force through that area. Then he would wait for the body to respond before doing more moves. That is one of the keys to this work. We have integration periods after sets of moves. We walk away from our client for a few minutes at a time and allow the brain to give feedback to the musculature. We sometimes work on more than one person at a time because of these required pauses. It's very common for an active Bowenwork clinic to have multiple rooms, and every time you've received a set of moves, you relax while the practitioner goes and does a few somewhere else and comes back. Because the work is done with such a respect for how much the body can handle at a time that the sessions can be minimal.